Professor Miller. Today my associate Jacob and I will be explaining what acute promyelocytic leukemia is. Acute promyelocytic, or APL, is a form of cancer which can affect the white blood cells in your system. First, my associate Jacob will explain the personal features of a patient with APL and how the patient lives throughout her life with this horrific disease. Next, I will explain the medical treatment for APL and explain both the process of the treatment and the side effects of the treatment. Finally, I will give your attention to Jacob to sum up what we have learned and give out additional information if necessary. Now, without further ado, I give you Jacob with the personal features of a patient with APL.
It can affect not only the patient who has the disease, but can affect all the people around them, their friends, family, work associates. The victim of this ravenous illness must live a careful life, no sports or any strenuous activity. Basically, the holder of this condition must live a sedentary lifestyle. People having this disease must have a clean, sanitized living space because of the dangers of their badly damaged immune system. Though the patient may go outside, it's more dangerous for them because of all the bacteria and germs that are in the air. The family needs the patient at the center of their lives. They need to be able to have their house clean and sanitized. They have to have organic food. They have to be able to take them to the hospital for chemo and other treatments if necessary. And it is important for the patient to make connections with friends, family, strangers, even if they small moments of happiness are very important for them. And the patient needs an open mind towards treatment, friends, families. They need to reach out to others just as the others need to reach out to them for sympathy and to help them feel better about themselves, even if
The treatment
momentarily.
of most causes of APL differs from the usual AML treatment. The initial treatment includes a non-chemotherapy drug, all-trans-retonic acid, or, as we pronounce it, ATRA, or just plain old vitamin A. Another option is to give the ATRA acid plus another drug called the arsenic trioxide. This is often used in patients who can't tolerate an anthracycline drug. What drugs are used depends on what is given for induction. Some of these options include the anthracycline along with ATRA for a few cycles, and anthracycline plus carbonate for at least 2 cycles. The arsenic trioxide for 2 cycles, or just over about 2.5 months. Then ATRA plus anthracycline for 2 cycles, then ATRA plus arsenic trioxide for several cycles. Side effects of this treatment can lead to breathing problems, low blood pressure, kidney problems, and severe fluid buildup elsewhere.
So today, in this presentation provided to you, we hope that you have learned a little something about acute promyelocytic leukemia. The facts that Michael had given were crucial for the understanding of this disease, as well as the procedures that you can take to diagnose and even treat for this disease. I had talked about how the patient and his or her condition can not only affect them or their family, but can affect like people they interact with, how they do things, where they go. But it's not only this, the holder of APL or the victim of APL must live a very careful, sedentary lifestyle. Everything has to be clean, everything they do has to be watched, everything has to be okayed by a doctor. And there are many tests that you can do to diagnose or even see how far along APL is, such as like a biopsy, or you can take bone marrow out of them to test the bone marrow if they need it. And these are just to see if the cancer is even there. Sometimes the cancer can be small, it can be big, it can be anywhere, it can be in the blood. If it's present, it's dangerous. So it's